Negative pressure wound therapy is helpful for wounds that come in all shapes, sizes, and depths. Dressing even challenging wounds can be done if you follow a few basic principles. First, assess the wound and obtain the appropriate dressing supplies. Cardinal Health has small, medium, large, and extra-large black foam dressing kits, as well as white foam dressing kits in 2 sizes. If the wound bed is 100% clean or granular, the black foam dressing set is indicated. If the wound bed is fragile, or if there is bone, tendon, or hardware visible, white foam is indicated to protect the structures. White foam is designed to be a protective, non-adherent interface. If there are tunnels or undermined areas, they will need to be filled. After you complete your assessment, thoroughly cleanse the wound. Next, consider the peri-wound skin. Usually the only preparation needed is to clean and dry it, then apply a protective skin barrier film. If the skin is fragile or macerated, consider applying drape strips to the wound edges to provide an extra layer of protection. If white foam is used, apply a single layer only. Next, fill the wound bed with black foam. Trim to the shape of the wound. It should fill the wound, lightly touching wound edges, but not touching or covering the peri-wound skin. If it is sized incorrectly and covers the peri-wound area, there is a risk of causing skin maceration or skin injury. Black foam may be stacked in deep wounds. Foam should be higher than skin level. It is not recommended to thin black foam. Thinning may cause overcollapse and prevent fluid from moving away from the wound base. If the wound shape is irregular, consider applying drape to the skin edges to protect them from the foam. Once the wound is properly filled, cover with drape. The drape should extend about 1.5 inches past the wound margins. To apply the drape, remove the A layer to expose the adhesive. Lay the drape down and smooth wrinkles. Next, remove the B layer, either from the folded end or from the labeled end. Separate the 2 white tabs to pull away the C static layer, leaving the draped wound behind. Finally, tear away the perforated tab. Decide the best location to place the speed connect. Cut a 1 centimeter diameter hole in the drape. Do not cut an X or slit. This may prevent proper delivery of suction. Remove the speed connect backing and place with the lumen over the opening on the drape. Smooth the adhesive interface to promote bonding. The blue tab remains on the speed connect border. Attach the tubing to the canister. Start the device and make sure it is set to the desired pressure and mode. As the dressing pulls to target pressure, mold the speed connect interface, drape, and skin interface. Small leaks will likely seal themselves. If the leak persists, examine the drape for wrinkles that could be causing the leak. Press down around the edges of the drape until the foam pulls down. You can use additional strips of drape to seal any leak that is found. If the leak persists, close the tubing clamp temporarily. If the device still indicates a leak, then change the canister. If the leak continues, consult the user's manual or call the clinical support line. You can get clinical support by calling the Cardinal Health Clinical Support Line or contacting your Cardinal Health sales representative for more information.